the recording. Good afternoon, everyone. My name is Valerie Haskin. I am the Rural Regional Behavioral Health Coordinator. I just wanted to go ahead and give you a quick introduction before we go ahead and get rolling with the content of this webinar. Thank you so much for joining us this afternoon. This is the first episode in a many-part series of a legislative session webinar series. So some quick housekeeping. This webinar is being recorded. These recordings will be made available on our partner website. So on the all Regional Behavioral Health Policy Board websites, nvbh.org. We also expect it to become available at least on the Behavioral Health Association of Nevada website, and likely also something associated with NPHA. So please keep your microphone on mute. Unless you're being called upon, I do reserve the right to go ahead and mute you if you accidentally have left it on, just so that we don't end up with a lot of weird sound in the background. If you are going to, we're going to hold all questions for the end. We'll do a Q&A. If you do have a question, go ahead and use the raise hand function to do so. If you can go ahead and please enter your name, title, and agency in the chat. We'd just love to hear who we have on the call and keep track of that. And then if you have any questions, again, please hold them for the end. So this series is a collaborative project done in part by the Regional Behavioral Health Policy Boards, the Behavioral Health Association of Nevada, and NPHA, or the Nevada Public Health Association's Advocacy and Policy Committee. The purpose of this webinar series is to help give you, the participants, kind of a current snapshot of what's going on in Nevada's behavioral health systems, what's been going on the last couple of years, what the current status is now, as well as what is currently being planned, because all of this will be affected by the legislative session. So it is hoped that by attending this, we can get you the most up-to-date information. We've also made our best effort to include people who are subject matter experts in the different topic areas, and particularly those who stand to not gain either politically or financially by these webinars. We do have some that are completely scheduled and ready for registration. This coming Wednesday at noon, we have the second part in this substance use system series, which is current state programs, followed by Friday at noon, future state programs, and what's being planned there. Monday, the 27th, we have the Advocacy 101 Toolkit, which was put together by the Nevada Public Health Association, and that will help participants learn how to engage in the legislative process, regardless of kind of where your status is in employment and funding. And then the last one we currently have open for registration is on January 31st, which is a Friday. My apologies for any confusion. There was some stuff going around that it was a Thursday. And that one will be about reading, understanding, and using state budgets for advocacy work, because ultimately, whether or not something is possible comes down to where the money is. We also have several other planned webinars, including various parts of the crisis response systems. We're going to talk about youth behavioral health workforce development, engaging with legislators, and we also are going to do a panel with the coordinators and also probably our board chairs to give some policy perspectives. A little bit of background on the regional behavioral health policy boards. There's currently 5 regions. Each board consists of 7 to 13 members who represent local and also professional perspectives. So there's law enforcement, legislators, treatment providers, EMS, etc. There's a very broad spectrum. We're allowed 1 BDR each legislative session, and membership is completely volunteer, except for the legislators, who I believe are pretty much voluntold. Just to give you an idea of what these regions are, the Washoe region is just Washoe County. The northern region includes Carson City, Churchill, Douglas, Lyon, and Story. The rural region, which I serve, is in blue here, which is Elko, Eureka, Humboldt, Lander, Pershing, and White Pine counties. The southern region is in green, which is Esmeralda, Lincoln, Mineral, and most of Nye County. And then the Clark region is, of course, Clark County, and then just the southern tip of Nye, so that it includes Pahrump. My counterparts and I are really the unofficial staff for the policy boards, and we work in conjunction with state agencies, local agencies, advocate for local needs, and work with our state agencies to make sure that the programs that they are applying for and the funding that they're applying for really match what's actually needed. So thus we are funded through DPBH, is Bureau of Behavioral Health, Wellness and Prevention, through OD2A and also the Mental Health Block Grant. Here is my counterparts and I. Dorothy serves the Washoe region. Sherilyn Rar Woods serves the northern region, which is those southern rurals. I serve those northeastern rural counties. And then our counterpart, Mark Funkhauser, serves the southern rural and frontier counties. The Clark RBHC position is currently vacant. So that being said, I'm going to go ahead and turn it over to Stephanie.
Good afternoon, everybody. Let me get my screen shared. Is that sharing the slideshow, Valerie? Can you confirm with me?
Yes, it is. And my apologies. It appears that the chat has been disabled. I will see what I can do to fix that, and I will pop in and let you guys know when it's available.
Thank you so much, Valerie. Good afternoon, everybody. My name is Stephanie Cook, and I'm the Deputy Bureau Chief with the Bureau of Behavioral Health, Wellness, and Prevention within the Division of Public and Behavioral Health. I am here to go through an overview of federal funding sources for substance use initiatives, and talking about the various federal entities that collaborate with us in the state to oversee substance use initiatives. I will be doing the Wednesday Lunch and Learn relating to Nevada-specific projects. So we will be talking more into details on what Nevada's substance use initiatives are happening on Wednesday. A quick disclaimer, I do not work for the federal government, but collaborate with federal agencies on overseeing substance use dollars in Nevada. Some of the content is shared as informational, and I can't always answer specific questions to all the entities. So about the Division of Public and Behavioral Health, our mission is to protect, promote, and improve the physical and behavioral health and safety of all people in Nevada, regardless of circumstances, to live their safest, longest, and healthiest and happiest lives. Our vision is where preventable health and safety issues no longer impact the opportunity for all people to live life in the best possible health. And our purpose is to make everyone's lives healthier, happier, longer, and safer. So our agenda today will be looking at an introduction to me and the work that is done here at the division, an overview of the federal agencies, some key funding programs that the federal agencies push dollars out to various states, some future directions that we see happening in the federal space, and some conclusion and question and answers. So our every state has a single state agency, which is the lead agency that oversees, manages federal funds dedicated to addressing substance use prevention, treatment, and recovery. That for us is our administrator, Cody Finney, the administrator of the Division of Public and Behavioral Health, which is then delegated down to our bureau. I also serve as the State Opioid Treatment Authority for the state of Nevada, really overseeing opioid treatment programs and ensuring accessible, high quality, and safe opioid use disorder treatment within those agencies. So as we know, prevention, treatment, and support to help people recover from mental or substance use disorders are essential strategies, both at the federal level and the state level, for the health and prosperities of individuals, families, communities in the country. In these unprecedented times, individuals and families across the nation are experiencing the challenges of living with substance use disorders. So we will start with kind of at the federal level, the importance of federal funding in tackling a national public health crisis. There's millions of Americans that live with substance use disorders. Opioids, alcohol, and methamphetamine continue to pose significant challenges nationwide. Our overdose rates have reached record levels in recent years, although have come down a little bit in the last year, year and a half. And we're also seeing polysubstance use. So in previous years, it was prevalent to see one substance being used, but now with various substances being used together, it's causing additional concerns. As we know, state and local governments often lack sufficient resources to tackle these issues. And so we rely on federal funding to bridge the gaps within our states and local systems. Ensuring access to federal to care and services includes services related to prevention, treatment, and recovery service supports. Our federal dollars also help promote health equity, really looking at underserved populations in our areas, ensuring that we're meeting the demand and looking at the data to see who's being affected and pushing those dollars to those populations. Driving research and innovation in order to look at long-term new treatments and data-driven approaches. We really rely on funding for research in this space. And it also helps to create a coordinated national strategy as we're looking at collaborating with all these federal partners together to really focus in on what the needs of our nation are and empowering communities. So a lot of the work we do comes down from the federal level and really puts it into action at a local level. The major federal agencies involved in substance use programming oversight are the Substance Abuse and Mental Health Services Administration, also known as SAMHSA. They have overview of grants and programs. Their mission is to lead public health efforts to advance the behavioral health of the nation. We see a lot of research funding coming down from the National Institute on Drug Abuse. They support scientific research on drug use and addiction. So they're really leading the efforts in studying substance use disorders and all the various things that go into that, and then working alongside SAMHSA and the other partners to then fund for those things, but really taking the lead with the research at the national level. Next, we have the Centers for Disease Control and Prevention, CDC, is to prevent the prevention and public health initiatives, and they're really leading the data-driven service organization that protects the public's health. So we lean on the CDC to really have a lot of to publish a lot of the data relating to public health and really base everything with science at the base. All of these programs are embedded in the general oversight of the U.S. Department of Health and Human Services, in which protects the health and well-being of all people living in the U.S. and provide essential human services. SAMHSA's key programs include various grant funds and programs at the SAMHSA level. Most importantly, the block grants for prevention and treatment of substance use is state level support. This is a non-competitive grant that's given to every state. And to really focus in on the gaps within our communities for substance use treatment, prevention, and recovery services. So the grant dollars used in every state look a little bit differently, but all kind of ensuring that we're meeting the needs of our community as it relates to substance use disorders and the prevention of those disorders. Our state opioid response grants are housed within SAMHSA as well, really looking at substance use disorders, but focusing in on opioid use disorder and stimulant use disorder to really push programs and funding to those with those specific needs. This is a competitive grant that is received from the federal level. There is also a sister grant to this, which is TOR, which is looking at the tribal opioid response initiatives. Alongside the SOAR program, just really targeting the tribes in our country and the need to address opioid use disorder there as well. The Strategic Prevention Framework Partnership for Success program within SAMHSA is really looking at substance use prevention within our youth. We know that going upstream and really getting to primary prevention efforts is needed in order to kind of stop the trajectory of substance use disorders in our state and in our nation. So really focusing in on programs to get to the youth, to really build out various programs and activities to focus on youth prevention and similar activities to help get those youth involved in other efforts in our communities and really take the lead within their peers in that space. The Drug-Free Communities Support Program is another program that is embedded within SAMHSA. It is also a Prevention Among Youth grant. This grant is specifically given to the various community partners directly from the feds. They work the same line of work as the Partnership for Success grant, really looking at going upstream and getting to our children and our youth with various activities to help mitigate that. And the last one for SAMHSA is funding for medication-assisted treatment. There is a specific grant that SAMHSA oversees, really focused on medication-assisted treatment. We refer to this as MOUD now, medications for opioid use disorder. The idea of medication-assisted treatment is more of a holistic approach to wraparound services, kind of wrapping around the medications needed to treat those with an opioid use disorder. Next, we'll highlight NIDA's role. NIDA is, like I mentioned before, they are really the leaders in our country that look at research funding and priorities for substance use disorders. They have specific grants supporting innovative treatments and prevention methods. We see a lot of their work focusing in around like medication treatments and how that works in different populations, different substance use disorders, and how that all plays into our brains and how our brains kind of wrap around all those initiatives, and really then working alongside of funding opportunities to then fund for those research initiatives. I've linked in here a link to NIDA's current strategic plan that runs through 2026 to really, if you're interested in diving into more of the research initiatives around substance use disorders, you can check out their strategic plan. Next is future directions that we see, engaging with our federal partners and kind of what are the funding priorities have been. Really addressing the fentanyl crisis has been at the forefront of a lot of our federal partners and in our state, really, in looking at increased funding for combating the widespread distribution and overdose risks of synthetic opioids. We're seeing a lot of expanding harm reduction services, including fentanyl test strips and naloxone access in this space. Really just understanding that fentanyl is so much more potent than other substances that we've seen in our drug supply, and really trying to tackle the crisis, as well as polysubstance use. The feds, in collaboration with all the states, are really looking at funding programs targeting co-occurring substance use. We know that based on all of our data from the medical examiner's office and our emergency room data, that it's usually not one substance that is affecting somebody. This notion of polysubstance is real, and it's out there, and it's across the nation. So we're all kind of tackling the use of polysubstance, as well as really focusing in, as I mentioned before, going upstream and focusing on prevention and interventions for our youth, specifically relating to vaping, cannabis use, and prescription drug misuse among our youth. We also, as I mentioned, an expansion of harm reduction services, really understanding that supporting for evidence-based harm reduction programs, help save lives in our communities. And so for the first time in ever, SAMHSA has created a harm reduction policy approach to embedded within their program. And so really looking at how we can use these harm reduction tools to save lives in our community. It really is also looking at integrating these services into our traditional treatment spaces. Innovations in funding models. We know that a lot of these funding models, if you were to look at these funding models across these federal agencies, a lot of them are specific to certain topics. We'll talk about this more on Wednesday when I go into what Nevada does with our funding, but really trying to get support for programs that embed substance use treatment into routine healthcare settings, really looking at braiding funding and getting the holistic approach to treating substance use disorder along the various funding sources. Let's see, collaborate. So then collaborating, we see a lot of collaboration all the time between our federal partners, our state partners, and local agencies. Really trying to ensure that we're all supported in this space. And so our federal partners do a good job at really engaging with the states, doing focus groups based on region to really see what the issues are. What's happening in the substance use space on the West Coast is way different than what's happening on the substance use space on the East Coast, but there are similarities. And so understanding kind of how things travel between the US and how we can use that information to better prepare ourselves and have, be ready to implement programs based on, the knowledge we have from our partners across the nation. And then, of course, continuous research and development, funding for new medications is always a priority. Therapies and interventions for various substance use disorders. Really looking at long-term recovery studies is what's happening in this space to see, to provide research on the factors influencing sustained recovery and relapse prevention. And then, as always, most of our federal partners are always looking at stigma reduction research. We know that we need to get better with promoting the stigma around all of this in order to improve treatment access and social reintegration for these folks with substance use disorders. So in conclusion, just a recap of the key points. To highlight the critical role of federal funding in addressing the substance use crisis. We know we can't do this as the state alone. The nation really helps provide all, the various resources across these federal agencies to help us to fund the gaps within our state that we need to fund. And the contributions of SAMHSA, NIDA, and the CDC, they all really help us utilize our federal support and our friends across the nation to really help build programs out in our state. Although, like I mentioned before, like things look a little bit differently in every state. But as far as really understanding that the federal support that we have in this space is important. The importance of collaboration and continued investment, to stress the value of the interagency partnerships that we create in this space to provide a treatment and prevention, treatment, and recovery of those with substance use disorders. And then our federal funding really empowers state, local, and community-based efforts to address our unique needs. There's various projects across the nation that are really focusing on the same things, but look differently for each state. And so, as I mentioned before, I will be talking more about Nevada initiatives on Wednesday. So with that, I've placed a few references here Also on this slide is the Bureau of Justice Assistance, the BJA, the Indian Health Service Agency at the federal level, and the Veterans Affairs Agency at the federal level that all have various programs for substance use treatment or recovery services. So if you click on that link I provided here, it'll bring you up to some other funding sources. Not all these funding, me at the Bureau level don't touch all these funding sources, so I may not be able to answer all the questions you have on there. So those are links that can provide you more information. So as I've reviewed today, federal funding is not just about the dollars in the sense, it's about lives saved, communities healed, and futures restored. So while the challenges we face in combating substance use disorders are significant, the collective efforts of our federal agencies, our state and local governments, community organizations, and individuals really give us reason to hope. With our continued investments, collaboration, and innovation, we can turn the tide on this crisis together with our federal partners and ongoing collaboration. We can create a future where prevention, treatment, and recovery are accessible to all and where each individual has the opportunity to reclaim their life. So join me on Wednesday for the Lunch and Learn, January 15th, to learn more about how the state of Nevada is leveraging federal and state resources to support substance use initiatives for Nevadans. And thank you for your time, and I'm happy to take any questions.
All right. Thank you so much, Stephanie. We really appreciate it. Yeah, we're going to go ahead and do some Q&A. I see Molly Rose Lewis has your hand up. You should be able to speak now.
Hi, folks. Less of a question, more of just a comment offer. Wanted to make sure that everyone on this call knows to please reach out to our office, which is that of Senator Jackie Rosen. If you are applying for federal grants, we can do letters of support from our office. We often do that along with the rest of the federal delegation as well to make it a nice sort of statewide or at least regional wide sort of I'm trying to say that sounds like excuse me, Mondays. Just trying to say that to show the federal agencies that the state needs whatever money you guys are applying for. So please definitely reach out to me or to our office. I am now the grants manager for Senator Jackie Rose's office, so I'll be the one handling the letters of support for any of that federal funding that you're applying for. And just wanted to make sure y'all know if you are having any issues with any of funding or agencies to reach out to our office as well so we can try to help navigate that.
Thank you, Molly. That is a fantastic opportunity. If anyone else has any questions, please use the raise hand function and I will go ahead and unmute you. All right, we have Ingrid. You should be able to speak now.
Hi there, and I apologize for taking up time. I was trying to reach out to some organizations through the chat, but it seems like we can't reach out to organizations individually. So I am with Intermountain Health, a part of the community health team, and we apply for federal and state grants to lift work, especially in the area of opioid and substance use disorder. My team is actively working on a grant application right now that's due within the next couple of weeks to expand services to rural Nevada with community health worker work. So I put a message in the chat with my email address if any organizations on here would like to reach out and collaborate or just learn a little bit as to what Intermountain Health is trying to do in the Nevada region, just feel free to reach out.
Thank you, Ingrid. You and I need to chat. We'll do that offline. All right, thank you. Anyone else? Last call. Okay, so if we are not getting any more questions, then what we'll do is we're going to go to move on, and I'm going to try to do a quick poll to get a little bit more information about who we have on the line here and what we can do to maybe pique your interest in future opportunities. So you should see a poll at the moment. The first question is, what best describes your current role? I know that sometimes our titles don't necessarily fully kind of capture that. So if you can go ahead and fill that out. Oh, look, we got somebody, one person answered. So We should have some more folks doing that. The second question is, what topic categories would you like to hear more about in future webinars? And so that includes mental health system updates, behavioral health workforce, evidence-based practices in various contexts, innovative practices. This particular webinar series is post to end probably the first or second week of legislative session, so middle of February. But I am hoping to maybe find some other topics that you are interested in and host some more lunch and learns moving forward so that we can keep the ball rolling. Okay. Oh, fantastic. We've got a lot of folks participating. We've got about 54. We have 73 people on the line, so I'm going to keep it open for another 5 or 10 seconds. So if you haven't participated yet and you would like to, please do. We got 5 seconds left. All right. Fantastic. Thank you. I'm going to go ahead and close this poll. All right. So on the line today, we have 20% would describe yourself as behavioral health treatment providers. 12% would call yourselves local or regional advocates. 8% would call yourself state level advocates. We've got 20% of our participants today are state level public agency representatives. 8% are local or regional level public agency representatives. 8% are healthcare providers, and 22%, our biggest category, fall into other. As far as other topics, mental health system updates and behavioral health system updates are tied. Looks like we're coming in. The biggest one is innovative practices from other states. Oh, yes, let's do lots of that. I love that you guys are interested in that. Also, how to engage in the legislative process. If this is something that you're interested in, please, 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 you're going to want to register for our webinar on January 27th. That's a Monday. It's 2 weeks from now, and that is going to be Advocacy 101, where Elise Monroy is going to be presenting the advocacy toolkit that NPHA has hired her to do. She is a lobbyist, so that is where that's coming from. Evidence-based practices and prevention. Not okay. We're not that interested in EBPs for mental health or substance use, but getting other system updates and innovative practices. Cool. Thank you. All right, everyone. So I appreciate your time. Any more last questions? I'd only let you pick one topic. Okay, so I'll see if I can choose all of the above. Much appreciated. So thank you. Please raise your hand if you have any questions. Going once. Going twice. All right. Thank you all so much for your participation today. We appreciate it. And if you haven't done so already, please check back in and register for the webinar on Wednesday. That would be the second edition that Stephanie mentioned. And we'll see you all then.
Awesome. Thank you. Thank you, everybody. Have a good day.